Masterclass 1 is probably the most important masterclass that we have here. I consider the best one because once you know the rules of bone augmentation, you can decide what to do and you can increase your predictability when you are performing bone augmentation procedure. And since this is the most important part, we are going to dedicate an entire day on this topic. We are going to talk about the biological principles of bone augmentation, the biological classification of the deficiency, and this makes you really to join freedom in terms of deciding what to do in a bone augmentation procedure, from a strategical point of view, from definition of the goal of the procedure, the determination of the material to use, and obviously the time related to the treatment. So, and this is really an important point of the Masterclass 1. The second day, because we have 2 days during this Masterclass 1, is dedicated more on the soft tissue management, something that is crucial to have the maximum potential of healing after a bone augmentation procedure. And this topic is going to be analyzed in depth. We are going to see incision lines. We are going to discuss different options, starting from the clinical point of view of the soft tissue and also regarding the final outcome or the expected outcome in that area. Then we are going to talk about how to elongate the flap in the different area, in the front maxilla, in the posterior mandible. We have different anatomical structures, so we must have different strategies. And then we are going to analyze how to close the wound to obtain the primary wound healing through a passive wound closure, which is crucial and is still probably the most important point in the soft tissue management and the point where the majority of the surgeons are failing during the bone augmentation procedure. So this will be the two main points of the Masterclass 1, and to focus particularly this aspect related to the soft tissue management, we are going to perform an hands-on training on jaw pigs, so to analyze better and understand better three-dimensionally what is the meaning of this strategy around the soft tissue. But we are going also to talk about GBR, particularly together with implant placement, so horizontal bone augmentation and vertical bone augmentation till 4 millimeters in the vertical direction. So we are going to cover strategical concept for obtaining a predictable bone augmentation together with important practical topics and messages related to the clinical approach to be very predictable in this type of bone augmentation.